Home self-monitoring is a daily recording of your hydration status, weight, temperature, and glucose results. You will record all fluids that enter and exit your body over a 24-hour period. This is referred to as your intake and output. Use your self-monitoring record sheet to record your daily weight, temperature, and glucose results. Use your 24-hour intake and output totals to fill in each row that applies to you. Send the record sheet to your healthcare provider weekly or as directed. Home self-monitoring is used to identify early signs of dehydration, bloodstream infection, and abnormal glucose results, which may lead to hospitalization if left untreated. Dehydration occurs when more fluid leaves the body than enters the body. Signs of dehydration include dry mouth, headache, increased thirst, urine that is dark in color, and dizziness, especially when changing positions quickly. A bloodstream infection is when germs enter your bloodstream and make you sick. To lower your risk of getting a bloodstream infection, always clean your hands before preparing your parenteral nutrition or touching your IV catheter. Always clean your IV catheter before attaching a syringe or IV tubing. Signs of a bloodstream infection include fever, shakes, and chills. Contact your healthcare provider right away if you have symptoms of dehydration or a bloodstream infection. The sugar in your blood is known as glucose. Having too much or too little sugar in your blood can be dangerous. High blood sugar, known as hyperglycemia, is when the glucose or sugar in your blood is higher than normal. Symptoms of hyperglycemia are nausea, weakness, frequent need to urinate, increased thirst, headache, and blurred vision. If you experience these symptoms, contact your healthcare provider right away. Low blood sugar, known as hypoglycemia, is when the glucose or sugar in your blood is lower than normal. Symptoms of hypoglycemia are sweating, paleness, nausea, headache, nervousness or shakiness, rapid heart rate, blurred vision, difficulty concentrating, and hunger. If you experience these symptoms, treat them first, then contact your healthcare provider. To treat symptoms of hypoglycemia, drink liquids with sugar, like juice or non-diet soda, or eat sugared candy. If you cannot eat, rub cake frosting on your gums or use instant glucose. Instant glucose can be purchased at your local pharmacy. To perform home self-monitoring, you will need a thermometer, a body weight scale, measuring containers, home self-monitoring record sheets, and 2 notepads. Use one notepad to record your 24-hour intake and use the other notepad to record your 24-hour output. Cleveland Clinic will provide you with the home self-monitoring record sheets and measuring containers. To track your fluid intake and output, use your measuring containers. Your measuring containers will list ounces on one side and milliliters or ml on the other. Some containers may have the abbreviation cc. 1 cc is equal to 1 milliliter. Record all intake and output in milliliters. To record your total intake, you will need to track all fluids that enter your body through your mouth, feeding tube, or IV for 24 hours. Solid food is not recorded unless it melts to a liquid at room temperature. Solid foods to include are popsicles, ice cream, gelatin, and ice cubes. Most prepackaged liquids such as bottled drinks, popsicles, gelatin, and soups have milliliters listed on the package. The PN row on your record sheet stands for parenteral nutrition. Once your PN infusion is complete, your IV pump will display how many milliliters were infused. Record this number in the PN row. Repeat the same process to record IV fluid, antibiotic, and tube feeding totals if you are receiving these therapies. If you do not use a pump to give other IV medications or tube feedings, record the number of milliliters printed on the IV bag or nutrition bottle. To organize your intake notepad, list the ways fluids enter your body. Here is an example of what your intake notepad may look like. To record your total output, you will need to track all fluids that leave your body, including urine, liquid stool, vomit, and fluids collected from drainage devices over a 24-hour period. Solid stools are not recorded. To organize your output notepad, list the ways fluids exit your body. Here is an example of what your output notepad may look like. You will track your intake and output on your notepads 24 hours before recording the total amount on your self-monitoring sheet. Your 24-hour window is from the time your PN infusion ends in the morning until your next PN infusion ends the following morning. For example, at 9 a.m. May 2nd, your PN infusion ends. Start tracking your intake and output. At 9 a.m. May 3rd, your PN infusion ends. Stop tracking your intake and output. All measured fluids that entered and exited your body from 9 a.m. to 9 a.m. is your 24-hour intake and output. Fill out the top of your self-monitoring record sheet. Print your name, goal weight, and diet. Your goal weight and type of diet will be recommended to you by your healthcare provider. Using the notepads in the previous example, your 24-hour intake and output ended at 9 a.m. May 3rd. Write May 3rd on the first column of your record sheet. Add the total milliliters from each section on your notepads. Record each total from your notepads in the matching row on the record sheet. Place the line through the row if it does not apply to you. Add and record your total intake on your record sheet. Add and record your total output on your record sheet. To prevent dehydration, your total intake should be 500 milliliters greater than your total output. Call your healthcare provider if your urine output is less than 1,000 milliliters for 2 days in a row, or your total output is more than your total intake for 2 days in a row. After recording your results on your record sheet, use a new page on your notepad and begin tracking your intake and output for another 24 hours. Repeat this process each day and record your results on the self-monitoring record sheet. Weigh yourself at the same time each day. Wear similar clothing and use the same weight scale. Contact your healthcare provider if you gain or lose more than 1 pound for 2 days in a row. Take your daily temperature before eating, drinking, or brushing your teeth. Glucose is measured by testing your urine using glucose strips or by testing your blood using a glucose meter. Test your first urine after your PN infusion is complete. You may urinate directly on the Diastix test strip or dip the test strip into your urine quickly. Wait 30 seconds before checking for color change. If there is no color change, the test is negative. Glucose was not detected. Write a negative sign in the urine glucose row. If there is color change, the test is positive. Glucose was detected. Write a positive sign in the urine glucose row and notify your healthcare provider. If you are a diabetic, use a glucometer to check your blood glucose 1 hour after your parental nutrition infusion is complete. Record your result in the blood glucose row. Contact your healthcare provider if your glucose result is below 70 or above 170. Let's review. Remember to record your weight, temperature, and glucose result on your self-monitoring record sheet each day. Treat symptoms of hypoglycemia first, then contact your healthcare provider. Measure all fluid intake and output in milliliters. Track your intake and output for 24 hours. Always contact your healthcare provider if you have symptoms of dehydration, a bloodstream infection, hyperglycemia, or hypoglycemia. Your urine output is less than 1,000 milliliters for 2 days in a row, or your total output is more than your total intake for 2 days in a row. You have color change on your urine glucose strip, or your glucose meter result is below 70 or above 170. You are now ready to perform home self-monitoring.